Now, Dr. Garrett Peel
He
here is
keeps
doing the
his
smart
trimmed
thing. You're
very
keeping yours
nicely.
trimmed. I guess that's legal, huh?
No shave November, but clip is available.
Yeah.
Clip is available.
You don't want to
Now
look
you
hairy.
tell me.
Yeah, well, I got berated for doing the goatee instead of the beard, so I haven't trimmed mine at all month long, and it's about to drive me nuts.
But
It's
it's
a
for a
final
good
week.
cause.
It is for a
That's
good
Can't
okay.
wait
cause.
for this weekend, yes.
It's over this week. And during this No Shave Month, we have talked about different types of cancers, primarily those found in men. You may have seen the Today Show on Friday when Willie Geist and Carson Daly underwent a live testicular exam on camera.
Now, compared to other types of cancer, testicular cancer is rare, but it is the most common cancer among males between the ages of 15 and 35. And this morning, board-certified surgeon Dr. Garrett Peel is here to let us know what we should know about this disease. Thanks so much for joining us.
Good morning.
Your beard looks good. You should keep it afterwards, I think.
Clipped.
Yes,
Yes.
Clipped, not shaved.
clipped, not shaved.
There
I
you
like
go.
that. I should
There
have
you
done that from the start.
But testicular cancer is scary. 15 to 35 years old, battling that as a man that young could be a very devastating cancer. And we know that most men who develop testicular cancer do not die because we can catch this relatively early.
Right.
And most of these cancers are very treatable with either surgery, radiation, and or chemotherapy.
As young as 15.
Yes.
Wow.
So how is it diagnosed at that age?
It's usually diagnosed with some kind of testicular pain or a lump, back pain, or even breast development in a
Really?
younger
See, these
man.
seem like things that a 15-year-old may not want to tell anybody about, right? Is that
Right,
part of the
it
problem?
could be a real private issue, and that's why it's important that we educate our men and our young boys to definitely do self-examination so that indeed they can find something that could be very treatable and found very early.
Yeah, and cancer does not discriminate when it comes to age. I mean, we all know that, even with men or women. So, so what is the best treatment for testicular cancer?
So usually after we are concerned that there is a potential cancer in the testicle, first blood work is done, an ultrasound is usually done, and then sometimes we'll just go right to removing the testicle from a surgical standpoint. In patients who have not had a descended testicle, they're at higher risk. And so for those patients, if we find a lump or blood work is abnormal with their tumor markers, we'll go ahead and just basically remove that testicle. Sometimes a biopsy is warranted, okay? And then once we have a diagnosis, then we can move toward usually surgery, followed with radiation if it's moved outside the testicle, and sometimes chemotherapy.
All right, but the good news is the survival rate is so high
Yeah.
for this. So that's the silver lining, I guess.
Only about 300 men a year in the U.S. die of testicular cancer, but still, that's a lot if it's someone that you love.
Right.
And so that's why we have to really educate our friends and family members and our young boys to make sure that they do self-exams
Sure.
and that they have a good relationship with their doctor too.
Yeah, and don't be shy if you find something. If
That's
you find
right.
a lump or anything unusual, you should definitely let your doctor know because
Save your life.
Absolutely.
That's
yeah.
right. It could save your life.
So glad to have you. Thanks so much for joining us.